Hi everyone, welcome to my channel. In this video, let's solve CPC exam practice questions from Genitourinary series. This is part 2. To study guidelines and practice solving questions related to genitourinary system, check the playlist CPC exam genitourinary system series. You can find the link in the description also. Let's start with the first question. Read the question. A VBAC is performed on a 30-year-old woman who received routine OP care for 9 office visits from physician A and postpartum care and delivery from physician B from a different practice. What would be the correct CPT code for physician B's services? Let us check the options. Check option A 59614. 59614 is for vaginal delivery only after previous cesarean delivery, including postpartum care. 59610 is for routine obstetric care, including antepartum care, vaginal delivery, and postpartum care after previous cesarean delivery. And check the first codes from option C and D. 59426 is for antepartum care only, 7 or more visits, and 59400 is for routine obstetric care, including antepartum care, vaginal delivery, and postpartum care. Now let us highlight the main terms in the question. In the question, they have mentioned a VBAC is performed. So, what is VBAC? VBAC stands for vaginal birth after cesarean. Okay, so in this scenario, a VBAC is performed on a 30-year-old woman who received routine OB care for 9 office visits from physician A and postpartum care and delivery from physician B from a different practice. In this question, we are asked to code only for physician B, who performed vaginal delivery and postpartum care, right? So the correct code for vaginal delivery only after previous cesarean delivery, including postpartum care, is 59614, which is present in option A. Okay, so the right answer will be option A, because in the scenario they have mentioned VBAC. So we have to code for vaginal delivery after previous cesarean delivery, and they're asking for physician B's services. So in this case, physician B is providing postpartum care and delivery, right? So we are coding 59614. We'll see why other options are wrong. Check option B 59610, that is for routine obstetric care, including antepartum care, vaginal delivery, and postpartum care. In this scenario, the 30-year-old woman is receiving routine obstetric care from physician A, right? In the question, they are asking code for physician B's services. So we are not supposed to code for physician A's service. Okay, so eliminate option B. And option C 59426 is for antepartum care only, 7 or more visits. So that is not matching with the scenario, because in the question they are asking for physician B's service, that is postpartum care and delivery. So we cannot code 59426. So directly eliminate option C. And option D 59400 is for routine obstetric care, including antepartum care, vaginal delivery, and postpartum care. But it does not include vaginal birth after cesarean, right? It is just for routine obstetric care, including antepartum care, vaginal delivery, and postpartum care. So we cannot code 59400, eliminate option D. If one code is wrong, the entire option will be wrong. So the right answer is option A. Remember, to code VBAC, vaginal birth after cesarean, we have to follow a guideline, that is, if the patient has a successful vaginal delivery after a previous cesarean delivery, VBAC, use codes 59610 to 59614. So you have to choose the appropriate code between 59610 to 59614. This guideline is present in your CPT manual, page number 454. First paragraph is very important. Highlight that. Let us move on to the next question. Read the question. The term episiotomy best describes a procedure of what type? Option A, an incision made in the perineum to enlarge the passage for the fetus during delivery. Option B, a procedure to initiate cervical ripening prior to labor. Option C, surgical removal of an oviduct. Option D, removal of lining from the cervix. So the right answer is option A. An incision made in the perineum to enlarge the passage for the fetus during delivery. An episiotomy is cutting the skin between vagina and the anus. This is usually done to enlarge the passage for a fetus during delivery. Let us move on to the next question. Read the question. A patient had a extracorporeal shockwave lithotripsy unilateral. Choose the correct CPT code. Let us check the options. Check option A 53899. 53899 is for unlisted procedure urinary system. 50592 is for ablation, one or more renal tumor, percutaneous unilateral radiofrequency. Option C also they have mentioned 50592 with modifier 50. Check option D 50590 which is for lithotripsy extracorporeal shock wave. So this is a straightforward question. In the question they have mentioned extracorporeal shock wave lithotripsy unilateral. The right code is 50590 lithotripsy extracorporeal shock wave. We'll eliminate other options. Option A 53899 is for unlisted procedure of urinary system. But there is a code present for extracorporeal shockwave lithotripsy, that is 50590. So we should not code for unlisted procedure. Eliminate option A. And in option B, the code 50592 is for ablation, one or more renal tumors, percutaneous unilateral radio frequency. So that is not matching with the question. According to the question, we have to code exclusively for extracorporeal shock wave lithotripsy. So we cannot code 50592 which is present in option B and C. So eliminate those. Before solving this question, don't forget to show your support to my channel by liking, sharing and subscribing to CodeMed Mastery. Read the question. A 48-year-old female presents with vaginal bleeding for the last 15 days. Upon examination, there is a mass approximately 3 into 4 cm hard and irregular on the right upper vaginal wall. A small amount of tissue is obtained from the vaginal mass and sent to pathology. Which CPT code should be used? Check option A 58100. 58100 is for endometrial sampling with or without endocervical sampling, without cervical dilation, any method. Check option B 57100 which is for biopsy of vaginal mucosa, simple. Check option C 57500 which is for biopsy of cervix, single or multiple, or local excision of lesion with or without fulguration. Check option D 56605 which is for biopsy of vulva or perineum, one lesion. Let us highlight the main terms in the question. That is, there is a mass approximately 3 into 4 cm hard and irregular on the right upper vaginal wall and small amount of tissue is obtained from the vaginal mass and sent to pathology. In your CPT manual index, when you check biopsy of vagina, you are directed to the code 57100 57105, 57109 and 57421. Review these codes to choose the appropriate service. So which among these is the right code? The right code is 57100, that is for biopsy of vaginal mucosa, simple, because that is the correct code to report for a biopsy, that is small amount of tissue obtained from the vaginal wall. Right, so we have to use the code 57100. So option D is the right answer. We'll eliminate option A 58100 because that is for endometrial sampling with or without endocervical sampling. In the scenario, they have not mentioned endometrial sampling. So eliminate option A, and option C is for biopsy of cervix. But in the question, they have mentioned small amount of tissue is obtained from the vaginal wall. They have not mentioned biopsy of cervix, and also there is no excision of lesion. Instead, there is biopsy. Small amount of tissue is obtained from the vaginal mass. So we cannot code for biopsy of cervix. So eliminate option C, and option D 56605 is for biopsy of vulva or perineum, one lesion. So that is also not matching with the question. So eliminate option D. Option B is the right answer. Next question. Read the question. A physician provided interpretation and results for a needle electromyography for anal sphincter function. How would you report this procedure? Check option A 51784, which is for electromyography studies of anal or urethral sphincter other than needle, any technique. And in option B also the first code is 51784, the second code 51785 is for needle electromyography studies of anal or urethral sphincter, any technique. And option C 55875 is for transperineal placement of needles or catheters into prostate for interstitial radioelement application with or without cystoscopy. And option D 51785 is for needle electromyography studies of anal or urethral sphincter, any technique. Let us highlight the main terms in the question, that is, the physician provided interpretation and results for needle electromyography for anal sphincter function. So, which among these is the right answer? The right answer is option D 51785, which is for needle electromyography studies of anal or urethral sphincter, any technique. In the question also they have mentioned needle electromyography for anal sphincter function. So it is exactly matching with the code 51785. We'll eliminate other options. 51784 is wrong because that is for electromyography studies of anal or urethral sphincter other than needle. But in the scenario they have mentioned needle electromyography, right? So we cannot code other than needle. That is 51784. Eliminate option A and option B also, because if one code is wrong, the entire option will be wrong. And option C 55875 is for transperineal placement of needles or catheters into prostate. So that is also not matching with the scenario. So eliminate option C. The right answer is option D. In option D, modifier 26 is appended, which is for professional component, because in the scenario the physician is providing interpretation and results. So we are appending modifier 26 for the professional component.